In this week's news, there have been claims from the US that Panadol causes autism. And when I say they're claims from the US, I mean they're just claims from the president. They're not supported by any health association from the US. And in fact, they've been debunked by health associations from other countries. I find it rather interesting, a little amusing, and frankly quite concerning and sad that places from other areas of the world have to actively debunk medical misinformation that's being shared by the US president. That's the world we live in now. I was doom scrolling at midnight last night. Don't ask me why, because the answers are depression and insomnia. I say don't ask me because the answers are boring, not because they're secret. And I came across an article on Pedestrian TV, which is I like this site. It's got a mixture of tabloid trash and interesting news. And I came across an article. Aussie medical experts shut down Trump's claims that Panadol causes autism. And I thought, that's one for me. I'll check that out at midnight, 12:35 a.m. to be exact. I also thought, once I started reading it, I thought I need to film a video and talk about this because this is bonkers. This is utterly bonkers. Donald Trump came out and claimed that taking Tylenol during pregnancy is bad, is dangerous because it is linked to higher rates of autism. Spoiler, it's not. There's no evidence of a link. He also said that they shouldn't be giving this drug to children unless absolutely medically necessary. Spoiler, people don't give this drug to children already unless it's absolutely medically necessary. People don't tend to give medication to children in general unless it's absolutely medically necessary. So what he said when he was speaking at the White House, he said, first, effective immediately, the FDA will be notifying physicians that the use of acetaminophen during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. I'll say it, it's not good. For this reason, they are strongly recommending women limit Tylenol use during pregnancy unless medically necessary. Extreme fever where women feel they can't tough it out. Women should not take Tylenol throughout their entire pregnancy, adding that parents should reconsider giving the drug to children unless necessary. Yeah, that's so Australian doctors and health professionals have had to come out and issue statements saying that there is no evidence to support this claim that Panadol or Tylenol in the US taken during pregnancy can cause autism. No health authority in the US or in Australia has endorsed this, has supported this. Dr. Danielle McMullen, she's the president of the AMA. I have my own personal issues with the AMA. My wonderful environmental and nutritional medicine GP who was treating my Lyme disease and my chronic illness, he was stopped from treating me by the AMA for their weird reasons about Lyme disease. I don't think I'm meant to really go into it, but yeah, I have my issues with the AMA. But she said on breakfast radio, there are no studies showing that paracetamol use in pregnancy causes autism. There have been studies showing us an association between paracetamol use and autism in children, but there's also been really large studies showing that there's no association. It's important to remember that association doesn't mean cause. That's something I found really interesting. Yes, there could very well be a higher number of autistic children receiving paracetamol. It doesn't mean that paracetamol causes it. It might mean, crazily enough, that autism causes certain issues that require the prescription of paracetamol or the dosage of paracetamol, such as headaches, such as light sensitivity, such as stomach aches, which are known to be common in autism. It's like saying that a lot of autistic adults, there's an association between autistic adults and liking stuffed toys. Therefore, liking stuffed toys will turn you autistic. No, maybe there's an association between one and the other because one, is connected to the other, not because one causes the other. Again, she reinforces the current belief, the general consensus that it's most likely that autism is linked with genetic factors as its primary driver, but we don't really know the full cause of autism. The TGA, the Therapeutic Goods Administration, they confirmed their official stance is that paracetamol remains pregnancy category A in Australia. So that means that it's considered safe for use during pregnancy. They have no current active safety investigations for paracetamol and autism or paracetamol and neurodevelopmental disorders more broadly. But yeah, it's like, again, Dr. McMullen reinforced that with any medication during pregnancy, you don't use more than necessary. You only use it when it's necessary, but that paracetamol is considered safe. It's just concerning that this could just incite a lot of panic and a lot of concern. There could be people who withhold medication from themselves as pregnant parents or their children who are in pain and who are in discomfort because of a fear. I'm just going to check out some other things. I don't have a script for this. I'm just freewheeling it, freeballing it. ABC News, experts say paracetamol safe for pregnancy. No proof for autism link made by Donald Trump. Yeah, doctors say that fever, which is commonly treated with paracetamol in early pregnancy, can be associated with several adverse outcomes. So withholding the paracetamol could lead to worse things if you don't treat fevers. Oh my goodness. Okay, so U.S. medicines regulator, the Food and Drug Administration, FDA, will issue a physician's notice about potential risks. Is that because the president said so? Or because they actually have evidence? Yeah, ideally you don't take it at all. That's Trump's thing. Okay. Yeah, Secretary Robert F. Kennedy Jr. announced that the FDA would change things, would have a physician's notice, which seems to go against the general consensus of the safety of Panadol. And that's the confirmation of other things, that you do not want to let fevers run wild. You don't. Yeah. If you need it, take it. You need to be more worried about the fever than the paracetamol. That was Dr. Norman Swan, host of the ABC's Health Report. Yeah. Yeah. It's also that thing of like, I'm more scared of my child having autism than of dying of fever. I'd rather my child die of a fever than my child have autism. Okay. themedicalrepublic.com.au. I've never really looked at this site. Garbage. Aussie experts dismiss Trump's paracetamol autism claims. Oh my gosh. Doctors are bracing for an inundation of concerned patients following the press conference held by Mr. Trump and his Health and Human Services Secretary Robert F. Kennedy Jr. That's the thing. It's going to really make people frightened. And the thing that like my partner and I have talked about sometimes is that Australia is so closely connected to the US now. A lot of people in Australia seem to believe that we're living in the US. People will refer to themselves by US like standards of politics, whether they're Republicans or Democrats, whether they're like blue or red or right or left wing. I mean, right or left wing is fairly universal, but if they'll refer to themselves as like not being liberal. But here in Australia, liberal is right wing. So it's like they forget where they are. And so a lot of people will listen to the things coming out of the US and take that on board. And if people are listening to Donald Trump and hearing him say these things, saying in the US, we are declaring it unsafe for pregnant women and children to take paracetamol or Tylenol, people in Australia will then take that on board because they are listening to a lot of that rhetoric. It is rhetoric. And a lot of that advice and taking that on board and living by it. The Therapeutic Goods Administration, TGI, has joined a groundswell of experts, peak bodies, and other groups who refute the president's claim. These include the Australian Medical Association, the Royal Australian and New Zealand College of Obstetricians and Gynecologists. These are the people who know. These are the people who know pregnancy. And I have a feeling they know pregnancy better than Robert F. Kennedy Jr. Yeah. Okay, so it was Dr. Danielle McMullen who described the comments as garbage, but said there were cohorts of the community who would be really worried by the story. We can confidently say that there is no study that shows paracetamol use during pregnancy causes autism. I don't know where Trump is getting this, because he clearly said that there is a high link. There's a definite link between paracetamol and high levels of autism, but also he parrots things that people tell him. He doesn't really do the critical thinking, so he relies on other people to do the critical thinking for him. So if somebody passes him a note, I mean, I'm pretty sure he also said that we should inject disinfectant to treat autism, to treat COVID. So I think that he sort of listens to somebody suggesting something and then announces it. He says the inside thoughts out loud. That's what Trump does. Obviously, women are already trying to reduce all medication use in pregnancy. People aren't just taking medication for the sake of it, but pain and fever can cause damage to pregnancies, particularly high fever in early pregnancy. That's Dr. McMullen again. I am also concerned that people will avoid paracetamol and take something else instead. We know that ibuprofen and aspirin can cause kidney damage in certain stages of pregnancy, so we've spent generations telling people not to do that. Paracetamol is one of the safest medications you can take. I've been taking 8 paracetamol a day for about 15 years because it's one of the ones that does the least damage. I also take a lot of ibuprofen, but it does a lot of damage. But paracetamol is one of the least offensive things, especially during pregnancy. And to take away one of the least offensive, the least damaging options for pain relief and for fever relief, it feels cruel. It feels very mixed messages, because what are people going to do next? Will people go more down a natural path, which could be very mixed up and have a lot of mixed messages, and have a lot of people taking advantage of folks, and have people turning away from standard medicine because they think my doctor is telling me paracetamol is safe, therefore they must be lying to me, because I know it's not, because I heard it somewhere else. That's the concern. I can't look at the Australian because I would have to pay. Yeah, The Guardian labels it as highly concerning and irresponsible. That's the biggest thing. It's irresponsible. Whether it's for Trump or his team, it is irresponsible to make claims like this. Okay, so in this one, they mention from the Society for Maternal Fetal Medicine to the American College of Obstetricians and Gynecologists. So this is American bodies. Doctors have endorsed the use of acetaminophen, Tylenol, Panadol, during pregnancy, after Trump said pregnant women who can't tough it out without the painkiller should limit their intake. Suggestions that acetaminophen can cause use in pregnancy causes autism are not only highly concerning to clinicians, but also irresponsible when considering the harmful and confusing message they send to pregnant patients, including those who may need to rely on this beneficial medicine during pregnancy, read a statement from Stephen Fleischman, the president of the American College of Obstetricians and Gynecologists. So here we have an American source, an American health body coming out to refute it, and yet the FDA is still following the president's lead and the government's lead without assistance and without endorsement and support from the American health bodies. Along with Trump, Health Secretary Robert F. Kennedy said the health department was encouraging physicians to exercise their best judgment by prescribing the lowest effective dose for the shortest necessary duration. The British health regulator MHRA said on Monday there remains no evidence linking the use of paracetamol during pregnancy with autism, and that it continues to recommend it for pain relief. That view was also backed by the TGA here in Australia, which reconfirmed on Tuesday that the drug is safe for use in pregnancy. A statement from the Society for Maternal Fetal Medicine said a thorough review of existing research suggesting a potential link between acetaminophen use during pregnancy and an increased risk of autism and attention deficit and hyperactivity disorder, ADHD, in children has not established a causal relationship. And poor Tylenol, they had to post on Instagram. They had to post on Instagram saying that people may have questions about conflicting information. They had to come out and say that there are no known links between their medication and autism. And medical and public organizations agree. But when you have the president and the government saying otherwise, oh my gosh, what a mess. What a mess. Doctors have also on social media, spread the message about Tylenol's safe use. If you are pregnant right now and considering whether Tylenol is safe in pregnancy, I want you to know that the best available science does not show an association between Tylenol use in pregnancy and an increased risk of autism. People are exceptionally confident no relationship exists. Oh my gosh. There was a Swedish study of 2.4 million births, which used actual sibling data and found no relationship between exposure to paracetamol in utero and subsequent autism. What a mess. What a mess. What a mess they're making. It's just adding fear. It's adding more fear. It's also pushing people to the outskirts, away from standard medicine, which is oftentimes safe. I'm somebody who uses a lot of standard medicine and environmental, nutritional, alternative medicine. You need to have a mix of both, but pushing people away from some of the most inoffensive, like simple standard medicines because of fear it feels malicious. It feels very malicious and cruel, and it's very concerning. But yeah, putting it out there. Raising awareness for this. Paracetamol is safe in pregnancy. Everyone except Donald Trump and Robert F. Kennedy agree that paracetamol is safe in pregnancy. And out of those two groups of people, meaning Donald Trump and Robert F. Kennedy versus the rest of the world, I put my money on the rest of the world. All right, I know this was very off the cuff. I wanted to talk about it. I could not be asked to write anything down because I've been very tired. Putting on lipstick and eyeliner was about all I could do today. Speaking of off the cuff, I've just released a podcast episode. Forgot what it was called for a second there. A podcast episode for the first time in about 3 months. It is also off the cuff because, again, I couldn't be asked to write anything down. It's called Reporting from Struggletown. It's just an update on my life and me going through shit. But yeah, check it out. I've got my website, nelltyler.com, and in my blog section, all of my blog posts have an audio option, and this one is pure audio. There's no written version. It's just pure audio. So have a listen to it. I'm trying to do those a bit more often, knowing that I can just have a chatting version without having to pre-write something is giving me a little bit of a breathing room. Even just doing videos where I can chat about news that I see. I see other people doing this. This is something that people can do. They just read stuff and they just talk about stuff. This is something that people do all the time. I don't always need to be polished and know what the hell I'm talking about. I can just talk about my feelings. Right? All right. Also, I will have something exciting coming up in the next month or two. It rhymes with Balbum. Just been working on the Balbum plover. But yeah, that'll be coming out soon. I might give you a sneak peek next time of just the Balbum plover, not the plongs. All right. I will see you in the next one. Stay safe, stay smart. Thanks for listening and learning. And if you're pregnant, take paracetamol for your fever. Look after yourself. All right. Bless.